Dental implants are now the most popular choice for patients suffering from tooth loss or are having issues with their own teeth. However, what's the percentage of success with dental implants? In this clip, we'll look into this subject thoroughly by examining the different factors that affect the effectiveness for dental implant. What are dental implants? Implants made of titanium are posts which are surgically placed into the jawbone in order to function as tooth-like artificial roots. The posts act as anchors for the replacement tooth, including crowns or dentures. Dental implants can last for a long time and sturdy solution for the loss of teeth. They have many advantages over bridges, dentures, or even bridges. The success rate of dental implants. The chance of success with dental implants can be very excellent, with some studies revealing successful rates between 95 and 98% in implant-related procedures. The success rate of dental implants could vary dependent on a number of variables, which include the general health, the competence of the dentist who performs the procedure, as well as the dental hygiene practices of the patient. Aspects that influence the rate of success for dental implant. 1. Health status. People with good overall health are more likely to get a positive outcome from a dental implant surgery. Medical conditions such as diabetes or heart disease may increase the likelihood of complications occurring during or after surgery. 2. Bone density. A good bone density is vital to the successful use implant dentistry, since the titanium posts have to connect to the jawbone. Patients with weak bone density could require other procedures, including bone grafts, in order to assure the successful operation of the dental implants they have. 3. Healthful oral hygiene. Excellent routines for oral hygiene, including brushing and flossing, frequently are vital to maintaining the condition of dental implants. Bad oral hygiene may result in gum disease and failure of implants. 4. Dental expertise. The experience and expertise of the dentist carrying out the implant procedure will greatly influence the outcome of dental implants. It is essential to choose the dentist with experience in implant procedures and has the highest success rate for the previous patients. 5. Smoking tobacco can drastically lower the chance of success with dental implants, since it hinders healing and can increase the likelihood of complications. Patients who smoke should be recommended to cease smoking before having implant surgery in order to boost their odds of achieving being successful. 6. Checkups. Follow-up appointments regularly with your dentist are necessary in assessing the effectiveness of dental implants and also dealing with any issues that could be arising. Patients are advised to follow their dentist's advice regarding post-operative care to ensure long-term viability of their dental implants. The rate of success for dental implants can be very good, with some studies revealing results of between 95 and 98% for implants. The success rate of dental implants is dependent on a number of variables that include the general health as well as the density of bone, dental hygiene routines, as well as the ability of the dentist who is performing the procedure. If you take these elements into consideration and adhering to the dental professional's recommendations on postoperative care and postoperative care, patients will increase the likelihood of having a successful treatment with dental implants.